Okay, you're
So
good.
for our international health project, we have chosen to study about the Zika virus, and the target population will be Brazilians living in the city of Rio de Janeiro in the state of Rio de Janeiro, Brazil. On May 7th, 2015, the Pan American Health Organization issued an alert about potential Zika virus transmission in Northeast Brazil. This has now been confirmed with widespread of the disease, underscoring the potential for Zika virus to spread globally, similar to dengue and chikungunya viruses. Due to the possible relationship between the Zika virus and clinical features, including microcephaly, ventricle, and eye deformities, the interest on this virus has increased gradually. Along with the vector-borne transmission, exposure via blood transfusion and sexual contact are further concerns. Infection with Zika virus is generally asymptomatic, and symptoms develop only in the 20% of the infected individuals. Clinical cases mild and self-limited, with symptoms including fever, maculopapular rash, myalgia, conjunctivitis, and other ophthalmological signs lasting for a week. Recently, however, the CDC concluded that Zika virus infection during pregnancy could be the cause of microcephaly and other severe fetal brain defects. Thinking about that concern, Brazil partnered with the WHO, the World Health Organization, and enrolled 345 women of gestation periods ranging from 6 weeks to 39 weeks into pregnancy, who presented with symptoms of rash for 5 days out onset, arthralgias, and low-grade fevers. And during September of 2015 through May 2016, 182 women participated in this program and tested positive in clinically lab testing. This resulted in over 42% of those infected at the time of pregnancy with grossly abnormal clinical findings in their children, unborn or born children, while during this study. The underlying clinical concern is for known infant deaths, growths, restrictions, and central nervous system abnormalities that are all non-reversible. The initial human clinical case was reported in 1957 through phylogenetic studies of Zika. Due to the dangerous level of this rapidly spreading virus that goes so easily undetected, it is imperative that measures are put into place to potentially eradicate any further spread of Zika. Recent data from the Ministry of Health in Brazil indicates that 56 cities in the state of Rio de Janeiro are in a situation of alert or risk of dengue outbreak, Zika and chikungunya, all transmitted through the same vector, that is Aedes aegypti. Of this total, 4 cities are at risk of disease outbreaks. Another 52 appear on alert, and 35 are in satisfactory condition. Rio de Janeiro, the state capital, is on alert. The Ministry of Health warns of the need to intensify actions to combat Aedes aegypti, even during the fall and winter throughout the country.
We have learned that the Zika virus is going to be spread through vector, which is going to be via mosquito bite. We have learned that there is several circumstances that's going on, and the most part that we're studying in this particular project is the area of Brazil and Rio de Janeiro. This is an epidemic level that has been hitting these particular cities, and this is not the first time that they've had this happen to them. So intervention is going to be one of the most easiest and upfront solutions from spreading the effect of the Zika virus and the spreading. So we're going to be focusing on the easiest and the most effective ways of preventive strategies to help the Zika problem. Of course, it's going to be community-based, based upon education, as well as direct and indirect help from organizations such as the WHO, the World Health Organization, United Nations, as well as local, as well as regional government officials and agencies. The most important thing is that we know that. Also, the community education is going to be super critical on knowing what you guys can do on a local level. So that's going to be the intervention I'm going to be discussing. The first and priority is going to be removal of objects containing any storage of water. That can be as small as a Coke can that actually has an inch of water in it. Water equals a breeding ground for mosquitoes, and that's how all this happens. The use of mosquito netting on windows over cribbing, over sleeping areas, and preferably a net that has been treated with insecticide. Another way that you can also do is mechanical measures, which is going to be putting a barrier between yourself and the potential mosquito bite. That's going to also come in the form of clothing, wearing a long sleeve shirt and maybe some pants versus a short sleeve shirt and shorts. And also the netting, making sure, if at all possible, to having the netting being treated with an insecticide. That's going to add another barrier to prevent the mosquitoes from coming at you. And finally, treating the home with insecticide as much as possible. That's another mechanical barrier that allows the mosquito from not being able to get to a potential new host. The most important thing, again, that can't be talked about enough, is water storage and water sources, and making sure if there's any standing water, being aware of your surroundings as well within your community, around your home, or even inside your home. So those are several interventions that you can do to stop and help the epidemic spreading of the Zika virus.
So our intervention is to address the problem through public service announcements to reach our target audience and address Zika virus on community approach. So here is our public service announcement.
Click and create. And create. Click and create. And create. And create.
So our public service announcement also provides an effective channel to communicate with the specific community of Rio de Janeiro in Brazil. So in addition to the public service announcement, other conclusions that we have come to is to also creating volunteer efforts and partnerships with local and state government level organizations to help implement mechanical controls, as well as donations of materials and financial assistance for those in need. Other concerns one may have in implementing the program can include the same public service announcement that was used in Rio may not work for other areas. There may be a lack of interest from the community, and this can be due to they are very content in their ways and do not have the means necessary to implement the program or to see it being effective. There's also a lack of financial support from the community as well as from the government. The government may not agree with what is being implemented. Therefore, they may not be able to provide the funds or approve the funds for it. There also another concern may be lack of resources such as equipment to create the public service announcements or to provide the mechanical control materials to help with the Zika virus problem in Rio de Janeiro, as well as there may be difficulty in reaching communities that do not have the means necessary to create these campaigns or reach other communities or gather volunteers who are willing to travel to other areas to help educate them on the purpose of the intervention.
So for some of the barriers that go along with the intervention, one of the things that we identified was funding. So whether we get our funding from locals in the Rio de Janeiro area, that government, or running like a campaign there for funding, or whether it comes from donations and participants in the United States or other places to go there. Funding could be an issue, which we would try to overcome funding issues by making more like a broad reach out to both places, make a partnership in whatever way we can, as well as doing the best that we could to include volunteer efforts so that we would keep funding for the intervention to a minimum. Another barrier that we discussed was being able to reach populations that may not be within close reach or might be removed from the denser populated areas. For example, our PSA that's would be like a television advertisement or possibly radio advertising. If there are people that don't have access to those mediums, that we would be able to. So one thing that we did was we created more of a infographic that could be easily distributed. And I have an example of that one here. So it's a very simple infographic that would have some basic information on the Zika virus and where it comes from, and some simple information on how to protect yourself from contracting that to where it could be easily distributed and carried for anybody to use or be able to distribute wherever, doctors' offices, schools, other public gathering places and things of that nature. Another that we discussed would be language barriers. So anything that we have printed or distributed would have to be translated into language for that area. So if it's coming from the United States, we would need to make sure that the translation would be complete and accurate for the information that's being put out. So that we would have to have that tested and make sure that everything's correct before being distributed, which would also impact the time frames on getting the intervention implemented. Another barrier would be like being able to prove the positive impact of running the intervention. So something to keep in mind would be tracking statistics on Zika that's being done, and also on any intervention that we do, to be able to say that by implementing the intervention, we should be able to show that Zika transmission or new cases of Zika have been reduced, or that the transmission has been slowed because of the efforts. Another large one that we discussed was incentive program for people that may not be really interested in getting involved, that may be just content with their life and their lifestyle and don't want to make any changes in how they do things. We could offer something maybe like a buyback program for old materials that can become breeding grounds for the mosquitoes, like the old tires or buckets and things that get left around that collect water. If people were to gather them and bring them, that maybe there could be some monetary reward or buy a purchase for those materials so that they could be properly recycled or disposed of, to get them away, to keep that from happening. And then, or maybe also something like giveaways, like long sleeve shirts that have a public safety message on them to raise awareness of the issue, and also to offer a level of protection for people that may not have otherwise cared, but if you gave them a free shirt, that maybe they would wear it. And I think that's all I have. So in conclusion, for the intervention, Zika is a big problem. We will address it by having educational workshops, public safety announcements, volunteer groups that can help train people on how the virus is spread and how to prevent it, as well as implementing a campaign to help people take control measures, mechanical control measures, and other safety precautions to help stop the spread of Zika.